The governor of New York State has declared an emergency in response to the monkeypox outbreak. Kathy Hochul said that more than a quarter of all monkeypox cases in the United States had been detected in New York. Among other new measures, the executive order will enable more health professionals, including pharmacists and midwives, to administer vaccines. Meanwhile, Spain announced a second death from monkeypox. The 2 cases in Spain and 1 in Brazil are the first known fatalities outside the African continent. Let's go now to Claire Dewsnap. She's the president of the British Association for Sexual Health and HIV. Joins me now live from Sheffield in England. We're told that mostly infections are mild. Usually the infections of monkeypox are mild. How concerning are these deaths that I just mentioned there, the 2 in Spain and 1 in Brazil?
Well, I mean, I think it's really critical that people understand that monkeypox has been associated with a mortality rate of up to 20% in some developing countries in the past. So the more new infections that we see, the more likely we are to see people who have other health conditions and not fully developed or impaired immune systems becoming sick because of this. I have to say it's also really important.
Sorry, go on.
Yes, no, it's fine. I mean, it is partly access to early healthcare, but also other health conditions that haven't yet been attended to or identified because of other issues with healthcare. It is really important that people understand, though, that this, whilst it's being described as a mild condition, it is already significantly impacting on people's health, and it is quite a painful condition for many people.
Yeah, and what about the vaccine? Well, it's the smallpox vaccine, actually, isn't it? And antivirals. How effective are they?
So we don't know how effective the smallpox vaccine will be when rolled out on a large scale. The data suggests that it's going to be at least 85% effective. We suspect it may be more than that. But until we've rolled it out and surveillanced those that have received it and ongoing infections, we won't know for absolutely sure. We know it will be better than having no protection. The antivirals that are available are effective, but not everybody is going to have access to those. So currently we are not giving those out to everybody. There are trials going on looking at what happens when you give those to people with different levels of severity of condition.
And presumably, if other places declared an emergency, that might help the access to vaccines, would it?
Well, I mean, there has to be an international call for massive upscaling of this vaccine. The WHO announced that this was an emergency to public health, and that part of that response will be massively upscaling production. We need equitable access, so we want more vaccine in England and Wales and Northern Ireland and Scotland, but we also need vaccine going to developing countries that up until now have not received any vaccine, even though there has been a recent increase in vaccine production. It's also really important that we stress that just having vaccine isn't enough. This country has a significant problem with capacity in its sexual health services, and then without that capacity being increased rapidly by increasing resources and funding, we're not going to be able to deliver the vaccine to the numbers that we need.
OK, thank you very much. That's Claire Dewsnap talking to us there.